Two Trump appointees spoke with the New York Times about what they called the White House's political manipulation of the CDC. They described what they saw as, quote, Washington's dismissal of science, the White House's slow suffocation of the agency's voice, the meddling in its messages, and the siphoning of its budget. This report comes as the CDC is currently involved in a massive effort to vaccinate the country. Joining me now is Dr. Celine Gounder. She is an infectious disease specialist and a member of President-elect Joe Biden's COVID-19 advisory board. So we had been hearing about the administration's stranglehold over science over the past 4 years, and obviously it came to a head when this pandemic broke out and there was an effort to slow down the messaging on how serious it was. This reporting, though, out of the CDC, how concerning is it to you?
It concerns me, Katie, because it really has affected the reputation of the CDC, has many people questioning whether the science coming out of the CDC can be trusted. And it's really demoralized people who've been working at the CDC through all of this, who've been trying to do what they can to fight the pandemic, to protect Americans, to save lives, and to feel that at every step of the way their work is being hampered, that they're essentially trying to do this work while wearing handcuffs is a very difficult position to be in.
This is a time when Americans really need to be able to trust their agencies, especially their health agencies like the CDC and the FDA. A lot of these things politicized greatly over the past year. How does Joe Biden build back that trust?
Well, I think his nomination of Dr. Rochelle Walensky, who I've known since the early 2000s as the new CDC director, is one very important step. She is a spectacular scientist, communicator, a mentor, and I think she, having her at the helm of the CDC, will really help. I think we're also going to see the return of, if not daily, frequent briefings from the CDC by CDC scientists so that Americans see that the response truly is being led by the best of the science.
What do you say to those out there? And I know we're repeating this a lot, but it's worth repeating. Those out there who do trust science and do trust the medical establishment and get their flu vaccine every year, but do feel nervous about this one.
Well, I would start by saying, look, I understand where you're coming from. This seems like this has been very fast. But I think it's important to understand that these vaccines, both the Moderna and Pfizer vaccines, the technology behind them, while it is being applied to these vaccines for the first time, these technologies have actually been in development for years, initially for other coronaviruses, SARS and MERS, and have been recently adapted for COVID, but that doesn't mean these are brand new vaccines or vaccine technologies. So it might seem fast, but it's not as fast as it might look.
Dr. Celine Gounder, thank you for that note of reassurance. I even know people who trust science, who are into it and are just nervous. They don't want to be the first ones to get it. Luckily for them, there's going to be a lot of healthcare workers in front of them and a lot of people who are much more in need before they get the vaccine to prove that it is safe. Dr. Celine Gounder, thanks for joining me today. We appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.